I'm Michael Battelle, President and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, as part of our patient-focused series, Liver Insights, Illuminating the Path Through MASLD and MASH, I'm excited to introduce Dr. Jonathan Stine, who's a hepatologist and associate professor of medicine and public health sciences and research director at Penn State Health Center. Dr. Stine is an internationally recognized liver expert with a research and clinical focus on metabolic dysfunction-associated liver disease. Today, in part 4 of our special series for patients who have already been diagnosed with MASLD or MASH, we will be discussing your voice, your power, harnessing the power of the patient's voice for personal and community empowerment. Dr. Stine, you are a well-recognized expert and leader in MASLD and MASH. Do patients really have a voice, and can they really make a difference in helping to raise awareness?
Yeah, Mike, first and foremost, again, thank you so much for having me again today. And I look forward to seeing the first three parts of this series once they're released. So, but yeah, patients absolutely have a voice. They are a key stakeholder, a key component of everything we do, and really a key driver in the recent change in the name of this disease. For those on watching today who aren't aware, we used to call the leading cause of liver disease worldwide, non-alcoholic fatty liver disease. So it was a negative diagnosis, the absence of heavy alcohol consumption. And then we had the word fatty, which, when you say that, sparks many different, emotional reactions, and understandably so. And, the patient voice was a big driver in the change from this, negative stigmatizing, name to one that was felt to be more inclusive of the actual disease process itself and remove the negative and stigmatizing, term fatty. So we now call this, metabolic dysfunction associated steatotic liver disease, which is a bit of a mouthful, but when you say MASLD, kind of rolls off the tongue, and you get used to it over time. But again, without the patient voice, without the advocacy, without the input, without even raising the fact that this made people feel uncomfortable, we probably wouldn't be here today with the name change, or certainly not as soon as we were.
Okay, that's great. And I was hoping that you can share some current data that you might have with those that are watching.
Yeah, absolutely. I have some thoughts I'd like to share with you just about, what patients, can do as we try to, harness the power of your voice, for both personal and community empowerment. So, before we get started, I just wanted to overview what this condition is. So, MASLD is very, very common. Luckily for us, most folks have the type that doesn't progress. So we call this MASL, or metabolic dysfunction associated steatotic liver. Again, there's no test at the end of this, or even if you ever meet me in the clinic, but what this means is just we have, fat in the liver, but it's not causing inflammation and it's not causing fibrosis or scar tissue. Over time, if this goes uncorrected, we can then develop MASH, or metabolic dysfunction associated steatohepatitis. And this just means we have enough fat in the liver where now we have inflammation. And this is about 25% of folks who have the overarching, metabolic dysfunction. And then from there, about 1% to 2% are going to progress to develop cirrhosis of the liver, which could cause you to have symptoms when you have decompensated disease or even primary liver cancer, both of which could necessitate a liver transplantation. So this condition is very common. If you have it and you're watching today, you're not alone. 1 out of 4 adults worldwide actually have this. And if you look at only folks who are diagnosed medically with obesity, 4 out of 5 are actually going to have MASLD. If we look at only individuals who have type 2 diabetes, 2 out of 3 are going to actually have this leading cause of chronic liver disease. So you have many friends, and that means we have a lot of work to do as researchers, as clinicians, as advocates. And this starts with the patient experience and sharing your perspective. And when we as researchers, we as clinicians, hear from you, it allows us to develop better treatment strategies. And we hear, what matters, what you're looking for. Most people, if they're going to use a medication, right, they want one that is not going to cause toxicity. They don't want to feel terrible taking it. They want one that's effective. But even beyond that, there are things that patients can let us know, and we can design better treatments. Other things we can do, we can try to enhance the diagnostic, process, remove barriers. and then come up with better ways to manage the disease, which may not necessarily require medications or frequent doctor visits. We opened up the talk today, discussing a little bit about stigma and the psychosocial impact of what we say and the power of words. And if we don't hear from you, we don't know how our words impact you as clinicians, as researchers, as a healthcare society. So, sharing this, allows us to, make sure we're communicating in a effective manner that is, one that allows people to feel comfortable. Sharing the patient experience perspective can also drive our research and our advocacy. And then, it'll allow us to create this supportive, environment where patients feel empowered to step up as leaders. And we need you as partners. We need your voice. And when your voice is out there, it drives change. There is no doubt about this. First and foremost, just sharing your story increases awareness of this disease. I can't even tell you how many people come in to see me and they say, "Hey, doc, I don't know why I'm here." And they haven't even heard about MASLD or whatever name you want to give this disease. And then we sit down and we go over why the referral was made and what it means. And hopefully through hearing more through the patient voice, we can raise awareness for this condition. Additionally, representatives, at the state and the federal level from the government, want to hear from their constituents. So if you get out there, if you advocate for policy change, if you advocate for disease awareness, you ask for more funding for public health, we're going to make a big difference. And this starts with the patient voice and not just with clinicians or researchers. Speaking of researchers, the patient voice can drive research priorities. And when trials are designed or public health initiatives come out, we absolutely need patients at the table and letting us know what we can do to meet the needs of this very large population with this disease. Again, patients' voice is working with their healthcare providers leads to empowerment, and shared decision making is something we all try to embody. And through this, we can really build supportive communities. When we hear what matters to patients and when the voice is loud and drives this change. The last point on the slide here is that the patient voice, allows personalization of the experience. And, if, you humanize things and we hear from you, we hear, what it's like every day. We hear how this impacts you when you go to spend time with your grandchildren or what your disease prevents you from doing. That really leaves an impact on us. And we can, look at treating the individual in front of us and really, that motivates us as clinicians and researchers. And that highlights a few of the challenges that are faced by individuals with MASLD. There are a couple more here. One, many patients experience a delayed diagnosis. In my career, I've seen many people who the first time they've heard they have liver disease when they're in the hospital with cirrhosis, and they have complications from bleeding or fluid in their belly. And clearly we need to do better to avoid a delayed diagnosis. Other challenges include some limited treatment options. We currently don't have a FDA-approved treatment here in the United States, although in 12 days now, resmetirom does go forward with the FDA for some of the preliminary discussions about approval. So we look forward to that, and hopefully we can remove one of these challenges and go from using medications off-label. We've highlighted stigma and misconception several times today, but again, this is a key challenge and one that we need to hear from you if we as clinicians and researchers are going to make changes to drive this field forward. Another challenge that I hear a lot from my patients is that, they have multiple medical problems they're managing all at once. And sometimes this leads to conflicting information. Dr. A says something different than Dr. B, or the medications are at odds. And I can only imagine what it's like to try to meld all these together and come up with some sort of coherent plan. And this is where multidisciplinary care, where you see multiple doctors in the same setting, is helpful. Other challenges include this unknown risk of progression to advanced liver disease. And as things stand right now, our predictive models are imperfect at best to say you will progress, or you will progress in X number of years. We try our best, but that uncertainty certainly weighs, on the minds of my patients. And, there are other things such as access to care and the need for long-term monitoring follow-up, which are unique, challenges and barriers that, we see with most chronic diseases, but certainly, MASLD is no exception to this. However, if through education and understanding these barriers and then removing them through what we deliver and improving overall, awareness, through this will lead to empowerment and, patients will be in a much better place. So if we can take away barriers and create a greater understanding of this disease and promote a healthy lifestyle and find ways to stick with the treatments through regular monitoring, people are going to feel empowered. And then you're going to do self-advocacy and you're going to want to share your story. You're going to want to, say, hey, I need these things. And, this is my hope and my dream as a clinician and a researcher in this field, that we create the environment, where patients feel empowered and are able to have these things each and every day. So what can you do? Well, advocacy and community engagement is going to be key. So, get out there, share your personal stories, participate in support groups if they're available, do educational events. You can find them through, many organizations. I'm sure Fatty Liver Alliance can help folks with this as we raise awareness and try to support research. Get out there, look for a clinical trial. Be the person who's going to help us, deliver and design the next, greatest treatments. And speaking of clinical trials and treatments, I did just want to end our time this afternoon together with the story of a patient of ours who, was diagnosed with MASLD and then chose to do some of the things we talked about through enrolling in a clinical trial to ultimately take control of his life and get where he wanted to be. So without further ado, I'd like to introduce you to Brian.
I wasn't feeling well, just run down and achy all over. But I always had this nagging pain in my back that radiated into my stomach. And that's what made me go to the doctor.
A visit that led to some tests. Doctors diagnosed Brian with non-alcoholic fatty liver disease. The news startled Brian, but he wasn't surprised. His sister had liver problems.
With the problem she was having, that she was going to need a liver transplant, and that was 11 years ago that she had that.
A liver transplant was successful for Brian's sister, but he wasn't ready to follow in her footsteps.
And I didn't want to go through that. Yeah, I seen how bad she was, the condition that she was in, and decided I better do something.
A new chapter in Brian's life began.
He comes in and he starts by walking on the treadmill for 5 minutes just to warm up and get ready for exercise. Then he does 5 dynamic stretches, and then he does 30 minutes of an activity of his choice. Typically he chooses to be on the bike, the recumbent bike, so his feet are out in front of him, and the machine that he uses, he gets to use his arms too. So he gets kind of a full body workout. And then after he does his 30 minutes of exercise, he finishes up with 5 minutes again on the treadmill at a slower pace to bring his heart rate down so he can kind of go into recovery mode.
I lost about 12 pounds this is the 14th week now that I'm here, so it's helping.
So the video I just shared with you is from a TV special on our local ABC affiliate here in central Pennsylvania. And, Brian chose to share his story when approached, by our research group in the news station to roughly 500,000 people within the catchment radius of the show. And, wanted to, take the next step in leadership and take the next step in getting the story out there about his journey. The special was about 10 minutes long and went into many different details of his life. But through this, he was able to advocate, for others who had a similar condition. He was able to raise awareness. He brought his voice into his community, and he continues to lead by example today, not only with sticking with, the exercise we taught him in the study, but also in leading community events, here with a grassroots, movement, and then performing some advocacy as well. So we're really grateful for him. And he's just an example of an individual who saw a way to take his, journey and turn it into an empowering story. So, what can everybody do? I just would challenge you today, if you're watching, get involved. Find something that works for you. Find something that's, exciting, and share your story. Get out there. Find others who are going through what you're going through. And, through collective action, this will continue to drive change and allow us to make a huge impact on this leading cause of chronic liver disease, which again affects 1 out of 5 or 1 out of 4 people worldwide. And, connecting with your community to raise awareness, is really going to be the way to do this. So whether it's through schools or social groups or even family events, these can be really, ways for you to take the next step and push us forward where we need to be. So with that, I think those are most of my thoughts. So thank you all for listening.
That was perfect. And it's exactly what I think myself and you representing a patient and what others I'm sure want to learn more about. And it can be scary sometimes not knowing that you can actually make change and do things. I think one of the things that came to mind when I was watching too was the familial aspects of the metabolic disorders, including, MASLD and MASH, and that just going to physicians and saying to them, hey, I have family members that maybe, they have all the risk factors that I do. Can you check them, test them, assess them as well? Right. So that I think that would be an easy example of someone using your voice to make change and trying to save other people's lives as well, right?
Yeah, absolutely. The individual Brian, whose story I shared with you, he would have not even come to see me if his sister hadn't started the advocacy first. So, she said, "Hey, I'm going to be needing a liver transplant. You should get checked out." And he put it off for a little while, and then ultimately, when he saw what she was going through, said, "You know what? I think I need to get checked." So without her advocacy, without her looking out for her family members, we may never have met Brian, and then he wouldn't have impacted, the thousands of people that his story has reached and touched. So,
Yeah.
again, it doesn't have to be big things. It can be even just, small conversations about the people you care about.
Well, also, if people would let the organizations that are local to where they are, like Fatty Liver Alliance, and say, hey, I would like to share my voice. I know there's at all of the liver meetings now patient-related streams where patients have an opportunity to share their stories, and the physicians learn a lot from hearing what patients say, because that's really the real world, right?
Yeah, absolutely. And I think the inclusion of that in our national meetings over the past couple of years has really just, further expanded a wonderful portfolio and a great experience for everybody. I've had the opportunity to lead at least one of the sessions, where we did a patient focused tour of the abstracts and went through, what was the highest, level cutting edge science, that patients needed to know about, right away that would impact, the choices they would make or the care they would seek. And I did that with Wayne Eskridge from the Fatty Liver Foundation, and that just really opened my eyes to a new world. And we can never have too many perspectives. Everybody deserves a seat at the table, and we need to make space for these conversations. And I know I'm a better clinician, a better researcher, a better person, for being allowed to be involved in those. And I thank everybody who's been a part of that.
Well, I am sure that people are going to watch and rewatch this video because you shared so many important points and ideas for people to pursue. Thank you so much, Dr. Stine, for taking the time today and for sharing your expertise. I know it's going to help so many people. Thank you very much.
Of course, always happy to stop by. Just let me know whenever you want me to speak again. And again, thank you for everybody who listened today. And patients are what we do everything for as doctors and researchers. And we're here for you. And please let us know how we can help. Okay.
Excellent.